COVID-19 immunity could last longer than once thought. That's according to a new study out of San Diego, California. Fox's Catherine Hawley tells us how long your body could stay ready to fight the disease.
In labs at the La Jolla Institute for Immunology, scientists wanted to find out how long immunity to COVID-19 lasts after you're infected. 185 people who contracted the coronavirus took part in the study, and 8 months after infection, most still have enough immune cells to fend off the virus and prevent illness.
What this tells us, I think, is that immunity is going to be long-lasting. The vaccines are going to work really well, and that once we have the vaccines in place, we're going to be able to put this whole thing behind us.
Optimistic results after studies found antibody levels can drop in a matter of weeks, raising questions about protection against a second infection. However, those antibodies are just one part of the immune system, and this new research focused on the B cells that produce antibodies. Some stick around and change into memory cells.
What this is a type of cell that says, yup, I recognize this particular virus when we got it. And I'm going to go ahead and hide away in your body. And if we ever see that virus again, I'm going to be able to jump on it, recognize it right away, and I'm going to proliferate, make lots more copies of me, which we're going to make lots more antibodies, and we're going to shut down that infection really fast this time.
The scientists found those memory cells last anywhere from 6 months to several years, ready to fight off a COVID-19 infection. Still, experts say there's a small percentage of people who won't be completely immune to the coronavirus and may contract it more than once.
And even if you are subject to reinfection, I think the chances are that you're going to mount an immune response pretty quick and you're not going to get any serious disease as a result of the infection. So this is really, really good news all around.
The number of new cases of COVID-19 in children has set a new record. The American Academy of Pediatrics and the Children's Hospital Association say over 144,000 new pediatric cases were reported between November 12th and 19th. That's the highest weekly increase ever. There was also a 28% increase in pediatric cases over the last 2 weeks. Kids make up more than 11% of all U.S. cases.